find out where and how you can get tested for an active infection. Quest performs COVID-19 antibody tests at our patient service centers. This blood test detects antibodies that show if you may have already recovered from a prior infection with the virus, even if you never felt sick. If so, you may possibly have a lower risk of reinfection. Understanding your antibody status can help you and your doctor make an informed choice about returning to work, school, and activity. However, if you have experienced COVID-19 symptoms in the last 10 days, your body isn't ready for this test, and you should not be in this facility until you've recovered. And we want to ensure the safety of all our patients and employees. You can get an antibody test 2 ways, with an order from your doctor or healthcare provider, or you can order the test for yourself online through Quest Direct. Once you have an order, simply make an appointment to get tested at your local Quest. You can obtain your COVID-19 results online through MyQuest, or wait for your healthcare provider to contact you. All Quest locations started a new Peace of Mind program to make it easier and safer to access your routine testing needs. First, we ask that you make an appointment instead of walking in. While here, everyone, including patients, must wear a face mask at all times. At most locations, we're checking forehead temperatures when you arrive and providing hand sanitizer and gloves at check-in. Our employees are wearing additional protective gear, and we're washing our hands and disinfecting all surfaces more frequently. We're limiting the number of people in waiting rooms to maintain social distance. You may also choose to wait outside and get a text alert when it's your turn through our Wait by Text program. Also, we cannot accept patients who are exhibiting any COVID-19 symptoms or may have been exposed to the virus in the last 14 days. Just as our team is taking these extra precautions to ensure you feel comfortable and protected while you're here, we hope you'll support these efforts by taking safety precautions as well. It takes all of us together to limit the spread of COVID-19. Please be aware that our hours of operation may change as we take safeguards to protect your health and follow evolving guidelines. For more information on what you need to know about COVID-19, visit questdiagnostics.com/COVID-19 test. Introducing EasyPay, a simple way to pay for your portion of lab testing. With EasyPay, you won't owe anything today. Here's how it works.
Hey, Glenn.
Based on your insurance, our staff will estimate the cost of today's visit. Provide your card and pre-authorize the maximum amount we can charge beyond what your insurance covers. We'll bill your insurance first. Your money is not held, and we won't charge you anything if your insurance covers the full cost of your testing. You're only charged if there's still a balance due. And if the balance is more than you authorized, we'll only send a bill for the difference. No balance, no charge. It's that easy. Have your card ready for EasyPay today. Thank you for choosing Quest Diagnostics.
I'm Andrew Sorkin with your top business headlines. A group of U.S. states reportedly set to file a lawsuit against Google. Reuters reporting the suit will focus on the company's Google Play App Store and will accuse Google of violating antitrust laws. And Microsoft has become the second company to reach a $2 trillion valuation, across that milestone in Tuesday's Wall Street trading, although it closed below that level. Apple currently worth about $2.2 trillion. And eyewear maker Warby Parker filed to the public. The company was valued at about $3 billion after its most recent funding round last August. Enjoy the ride and tune in to Squawk Box on CNBC every weekday live from the NASDAQ market site at 6 a.m. Eastern Time. And follow our podcast, Squawk Pod.
Welcome to Quest Diagnostics. If you are a patient who is blind or visually impaired, you can automatically check in by swiping or dragging 3 fingers in any direction across the screen of our check-in kiosk without providing any additional information. Once you have successfully done so, the kiosk will play a short audio message informing you that you have checked in and assigning you a patient ID. Please Please take a seat, and your patient ID will be verbally called by a Quest team member. The Quest team member may collect additional information from you at that time. If you need assistance with locating, using, or checking in at the kiosk, our Quest team member will be happy to assist you. If you don't have an appointment or would like to make one, please call 888-277-8772. Thank you for choosing Quest Diagnostics. Quest Diagnostics understands how important lab testing can be when making decisions about your health. We also understand how important it is to know how much you'll pay for testing. When you are asked for payment today, we will provide as accurate an estimate as possible of what your out-of-pocket costs will be. However, there are several things we take into account when determining what you owe, including things that are out of our control. First, we connect with your health plan to see how much your test is covered. Next, we factor in deductibles, co-payments, and co-insurance. Depending on your health plan, each one of these can affect how much you may need to pay for the testing. Deductibles are a set dollar amount you pay before your health plan coverage kicks in. Once you've reached that dollar amount, your health plan begins paying for covered services. Many insurance plans also have a co-payment. This is a set dollar amount. For example, $10 that you have to pay each time you visit the doctor, have lab testing, or receive other medical services like an x-ray. If you have a co-payment as part of your plan, you'll have to pay it even after you meet your deductible. In some cases, your health plan may require you to pay co-insurance, which is different than a co-payment. Co-insurance is a set percentage you must pay for your health services after you have met your deductible. For example, your health plan might pay 80% of a covered health service and require that you pay the remaining 20%. As you can see, there are many factors that Quest considers to figure out what you owe for lab testing. It's also important to note that your lab testing is separate from your doctor's visit, which is why it's spelled separate. When you come to Quest for your lab testing, we estimate the cost of your test based on your insurance and let you know how much it is before the test is performed. While our goal is to give you the most accurate estimate based on the information we have, what you ultimately pay could be less or more. Quest allows you to pay for your testing at the time of your service. All you need to do is provide your credit card or health savings account information to us and authorize the amount to charge after the payment is processed with your insurance, which usually takes less.
She was so gentle.
Huh?
She was gentle.
Gentle with your arm?
Yeah. I even made a comment to her. Oh my God, you're so gentle.
Yay!
I'm starting to get smoked somewhere.
I guess.
I hate it when you put that rubber band thing on you. Oh my God. It starts like making my stomach turn and shit. I don't like that feeling of like rubber on my skin, you know? Stretched over my skin like that. I don't like it.
Somebody caught him 5 months later. It bothered me.
Well, you know, maybe the first time somebody was a little suspicious, but you don't want to be accused of